Hi, everybody. Welcome. We have a great guest, someone that's a good friend and I've known for, I think, over 10 years.
Mm-hmm.
Yeah. And who probably, if you take all the aspects of all things perinatal, so you take like pregnancy, all the things that come with pregnancy, like what do I eat, nutrition, what do I not eat, exercise or not, yoga, mental health, then like the delivery process. I want to avoid a C-section. I want pain meds. I don't want pain meds. Where should my partner stand when I'm delivering, right? All the delivery stuff. And then postpartum, right? Whether it's postpartum blues or depression, breastfeeding versus formula feeding, postpartum nutrition, HR related things like when should my partner take paternity or maternity leave, all those things. When you put them all together, look, I know folks that are exceptional lactation specialists. I know folks that are exceptional therapists. I know exceptional doulas. But when you take all those things, put them together, I haven't worked with a person who I think is as much of an expert across the spectrum of motherhood and maternity. And so I think having this guest is a real gift for, at a minimum, mothers and mothers to be. But I even think for partners like me, understanding the perspective of a mother will make you a better partner, which I hope is a goal. And so very excited to have Jayne Freeman here. We're going to get into some technical specific stuff around her expertise. But before we do that, I'm a big fan of personal journeys. I find people's stories as interesting as their professional stories. And I find that the most interesting people, they tend to be connected, right? Like I find people who have courage and something interesting to say tend to be doing something with their life that they're personally rooted in. That's just been my experience. And so I would love, Jayne, if you could just start wherever you think is appropriate and take us through your journey up to today.
Oh, wow. Thank you. And thanks for having me here. My journey. My journey started when I had my children. I mean, it's that basic. I had a really interesting first birth, followed by a really fast and interesting second birth. My second birth was only 90 minutes, start to finish. I barely made it to the hospital. She could have been born in the Holland Tunnel, but, you know, we did make it through, and she was born in New York. And right after that, I was like, everything about pregnancy, childbirth, and what comes afterward was exceptionally interesting to me. So I started a public access show called Mama Rama, and I started making videos just talking about those three things: pregnancy, birth, and the immediate postpartum period. Just sharing like all the things that I was going through. The sleeplessness, the shifting identity, the struggles, the trying to juggle two children. There was a lot to share. And, you know, I just stayed with it. I kept making my show. And the more I did my show on Comcast Public Access, the more I was like, this is what I want to be doing all the time. I don't want to be working in software sales and all the different stuff I was doing in educational software. So I segued over to becoming a childbirth educator first, a birth doula, then a postpartum doula and breastfeeding counselor. So currently I do my postpartum work and I still teach. So, I mean, all of that took about 20 years. Yeah. I mean, it was like a long journey, but, you know, I'm very happy with that.
Awesome. So I will get to some more specific stuff, but before we do, just as an intermediary, can you just give us an example, like in the past 2, 3, 4, 5 months, give us like an example of your typical client. Is it, hey, me and my partner are pregnant, we just found out, and hey, can you help us? Or is it, we just had our baby? Or what? Give us a typical situation where your expertise can be leveraged to help folks.
Sure. People come to me in their pregnancy. I just had this couple come to me while they were pregnant because she was very anxious and nervous about everything, about the birth, about what was going to happen afterwards. And just, she had a million questions. And the thing is, you can't really get those questions answered by your OB. They don't have time to sit down and go through all of this stuff with you. And then there are also topics that the OB is not going to address, like what kind of stroller should I get, or should I get a snoo or not get a snoo, So sometimes people come to me for advice during pregnancy. Then I meet a lot of people when I'm teaching. So those people are pregnant and they're projecting ahead, thinking about what is it going to be like when I have a baby. And then I have another set of clients that just come to me after they've had the baby. They're struggling. Things aren't going well. The woman may be experiencing more than baby blues. She may be having postpartum anxiety or perhaps postpartum depression. There may be conflicts in the relationship. There's so many different challenges. So I'm not just the baby expert. It's not just about that. It's this kind of full-blown care and support that is about the whole family. It's about the baby, but it's also about the parents. It's about the relationship. It's about their changing identity into parents and the challenges that come with that.
Yeah, that's a really, really thoughtful way to put it. So this is the second time you've used the word identity, and I'm fascinated by the way you kind of tee it up. So you talk about shifting identity.
Mm-hmm.
Can you, I guess, your personal experience as a woman who became a mother, and then just your experience with your clients, like, so let's say there's a woman listening to this who is, I don't want to use the word necessarily struggling, but is grappling with the fact that 5 minutes ago, I was a young professional with no real responsibilities other than my own. And now I have, to prioritize and balance all these different things because I'm actually responsible for another human. Plus my body's changed, plus this, plus that. Can you talk about, maybe give some tips on how to deal with the shifting identity? Because I think it'll apply to the scenario I just gave, but it applies to all of us. Like the tools for a shifting identity. I've never had a kid, but I might shift as a man careers, or I might suddenly be single or divorced or married. Can you just talk about what you've learned and good tips on how to deal with a shifting identity?
I don't know if I have like specific tips, but when you ask about that shifting identity, the way I would describe that is there's actually a word for it called matrescence. A lot of people don't use it or don't even know what it is, but it really is a transition in a woman's life that comes between menarche, when she gets her first period, and menopause, when she ends her reproductive life. So any woman who chooses to have children also goes through matrescence. And the more you know about it, the more you understand how everything changes. Your brain chemistry changes, your body changes, your identity changes with that. The better you can accommodate that. There's a very strong narrative, I think, in the postpartum world about like getting back to yourself, getting back to your pre-pregnancy body, getting back to who you were, that sort of thing. But there's not enough narrative about who are you now? You've been changed by having children. So why not embrace who you are now and not feel like you have to go backwards, but just sort of embrace who you are in the moment as a mother or as a parent, because dads go through it too, a little bit differently because their brain chemistry doesn't change as much. The brain chemistry is changing because of pregnancy and can continue to change if she's nursing. Just the influx of estrogen and all the different hormones that are going on in your body really make you a different person. They make you more intuitive, more compassionate, more attentive, and even more sensitive. So this is why new mothers are extra sensitive. And I know you know this. You see them in the office when they're crying for no reason, or they perceive some observation to be a criticism of them. And that's why the struggles with breastfeeding can be so difficult, because they've attached their worth as a new mother to this endeavor. And if they can't achieve that endeavor, then they struggle with that and they have feelings of shame and guilt. So your question was more about tips. I feel like it's all about support, really. You need people around you who are helping you through this new transition of becoming parents and giving you the space to become who you are, and to maybe babysit and to give you breaks periodically so that new parents can kind of reestablish the relationship and nurture the relationship. Because that first year There's not a lot of intimacy going on. I see a lot of parents who bicker and argue and become kind of strangers to each other as they're going through the rigors of having a child or having more than one child.
Okay. And then you mentioned breastfeeding.
Mm-hmm.
That's obviously like, when I think of common denominator topics that come up like with moms or moms to be, that's near the top of the list. That's like probably top 3 consistently. Can you give, I really love your perspective. Obviously I've heard it before, but I love your perspective on breastfeeding or not. Can you give your 2 cents as an expert?
Well, it is a complicated subject because the emphasis now in this generation of parents is a complete emphasis and expectation that you're going to breastfeed. We understand that breast milk is ideal for babies. It carries immunities and antibodies and all sorts of things that are really good for babies. But it takes away, when you have a narrative that is that strong, it undermines all the women who struggle with breastfeeding, for whom it's not really the best choice, or just struggle with it so much that it becomes impossible. And they spend their entire maternity leave solely focused on the act of breastfeeding, and sometimes don't even enjoy their child because they're so fixated on this.
Or resent the child.
And they can actually resent the child. I have seen that a number of times. Yeah, so I just wish we could kind of like dial that back a little bit and come to a sort of a meeting ground where it used to be pushing all formula. That was the thing that parents were told is the best thing for their babies. And now we've gone in the other direction where it's like, no, you must breastfeed at all costs. Mm-hmm. I would love for the emphasis to be on the mother.
Yeah.
On the mother. Right. Just protecting her mental health and her well-being, and allowing her to do what she feels is right for her. Maybe that's some breastfeeding or no breastfeeding, or pumping or no pumping, or some formula or all formula. But you don't see it presented that way. That's not the narrative. And I know this because I've taught classes in many different places. And that's not how the presentations go. The presentations for newborn care is all about the emphasis on breastfeeding.
Yeah. I agree with you 100%. And I agree with your perspective. Like you talk about, I like how you put it, like the emphasis should be on the mother. Mm-hmm. And I think people are like, but wait, we're talking about having a baby. I think what people don't realize is the mother and baby, I see them as very connected. Like I don't see it as such a binary thing, which on its face, that perspective may feel like disempowering. Yeah. But the reason I don't think that is I'll see a mom come in anywhere from, the first visit, like 2 days after discharge, like let's call the kid a week old, or the 1 month visit, right? And anything in between. And mom's like run down, worn out, can't move, can't think, irritable, because if you're sleep deprived, you get irritable.
Yes.
And baby crying and trying to breastfeed, trying to do whatever. And what I always tell them in that state is like, would you want me as your doctor, as your kid's doctor, to be sleep deprived, hungry, moody? You would say, no, find me a new doctor because you're probably not going to make the best decisions. Right. I tell them, you're the real pediatrician. Okay. I tell them, the real pediatrician in this equation is the mom.
Right.
Now, I'm a professional pediatrician, but I think you're the real pediatrician. I have something to offer in terms of, hey, doc, the circumcision doesn't look right. Fine. Step aside. Let me take care of that. But that's 5% of it. 95% of this is at 3:45 in the morning when I'm not there, holding the child, feeding the child, changing the child. And you can't be the best mom / pediatrician if you're not the best version of yourself. And if breastfeeding makes you the best version of yourself because of the sense of satisfaction, because of whatever, awesome. Right. You have nothing but our undivided support. We'll do everything to help you.
Sure.
But if it's counterproductive, then it's just that, it's counterproductive. And I tell people, look, 1,000 years ago when we didn't have formula, and if you didn't breastfeed your kid, there was a problem, and we were cavemen for sure. Let's fight and claw for it. But it turns out that we have a pretty decent alternative that, can help you and the baby. And all this is not to make a decision for the mom one way or the other, but to actually create optionality.
Exactly. I always say to people, like, we're in this culture of inclusivity all the time, but we don't see that with breastfeeding. That the new mother is not really subject to inclusivity in terms of her choices. Yeah. It's like, this is what you're supposed to do, and she will fight for it really, really hard, because the alternative doesn't feel right. Yeah. The alternative, it feels like you're being not as good a mom as you're supposed to be. Oh. But you have a really important role, because they need to hear from an authority figure that it's going to be okay. Yeah. And when a pediatrician tells new parents, your baby is going to be just fine, we like you said, we have good formula. There's however way you're doing it, your baby is going to survive and thrive. But when we get into a position where a mom is really feeling depleted and, like you said, is not at her best, we really have to look at that and say, how can we make this better? How can we change the narrative so that you feel like you're doing the right thing just by taking care of yourself?
Yeah, I think that's something that people need to. I used to always get really pissed off when I used to be like, I used to live in the hospital, like probably for a decade, I lived in the hospital. And when you're in the hospital, like they have these pamphlets for moms that they give out. They say like breast is best or whatever.
Sure.
And the cover of the pamphlet, at least where I used to go, the cover of the pamphlet had a new mom, double fisting twins on her breasts with a smile. Yeah. And I would always tell like the administrators, I'm like, dude, you gotta like throw that out and not give it to them. Like, why, Dr. Baker? Look, she's smiling. It's like happy, blah, blah, blah. I'm like, dude, I don't think you see that when you drop it off in the room. Yeah. I see it once the mom's reading it and she's in tears, because you're setting what you're doing is you're feeding them information that this is the expectation. And of course, that's not how it goes. The kid doesn't get on and latch the first time and everything's bubbly. It's a process. It's a journey. And I tell them, actually, when you tell the mom up front, breastfeeding can be very challenging, then it is challenging. They're not let down. They're like, no, oh yeah, it is a struggle. But when they think it's not, because on Facebook, everybody's bragging about it, or the pamphlets say it's easy and it's inevitably not easy, that actually only enhances the gap between what they think they should be as a mother and what they feel now they are not.
Exactly. That is the narrative. And it's a very militant narrative. Doesn't give a lot of room for prioritizing the mother's choices, her mental health, her well-being. So that's the conundrum. And also there's this whole element of social media. Yeah. The expectations that women see every single day as they scroll on TikTok or Instagram. And they're just like, oh, that's how I'm supposed to be doing it. That's how I should look doing that. Right. That's how I should be more organized. I mean, there's so many examples of like how you should do things. Yeah. And there's plenty of people who have presences on social media that are self-deprecating, or they're jokesy about like, this is really hard and I'm not winning at all. Yeah. But I don't know that everybody gets that message. I think it's a lot of what they should aspire to, and that feels like a lot of pressure.
Yeah, and zooming out just for a sec, like I think that the breastfeeding thing is a big one, and it happens early. But I think actually in terms of motherhood, and then even by extension parenting, right, to bring the partners in. Yeah, I think there's very few things in life that are as preconceived dogmatic as what you should or shouldn't do as a parent, right? Like I'm a doctor, and you'd be surprised how little bit doctors talk to doctors about how you should doctor, right? And it's a scientific profession, and we don't sit around saying, hey, the way you doctor's not right, and the way I doctor is not. And I know a million doctors, and you know what we don't sit around? We talk about everything except how each other doctors. And of course, there's like a certain level of professional respect for this person or that person and so on. Yeah. But why is, even though we studied for a long time the right way, quote unquote, to do stuff, and it's very scientific and very algorithmic, you know what we all know? The patient never reads the books. And I've been doing this for 17 years. And in 17 years, I've never seen a kid do what the books say they'll do. And so that does a couple of things. It humbles you and broadens your mind, in the sense that you say, all right, I know kind of all this information, and that's just a backdrop to reality. And it's kind of guardrails. And I want to make sure the kid doesn't lose too much weight, doesn't gain too much weight, but I'm not going to be like, he should have gained 3 pounds, 4.5 ounces, and, that kind of stuff. And so on the flip side, when you're parenting, we talked about the breastfeeding pressure. And yes, some of us, like in healthcare, like maybe the likes of me and you, have something to do with that pressure. But I'll tell you where most of it comes from. It comes from society, not just healthcare. Like when the mom has had the baby, she's already had the sister-in-law who's bragging about how she breastfed forever. And like her kid started walking at 9 months, not 12 because of breast milk, quote unquote. Right. And like, he doesn't have allergies because she breastfed him and all this stuff.
Right.
So Aunt Susie, who's got a big mouth and, very little knowledge, has been in, the mom's ear for 9 months. Yeah. And then sometimes even the partners, like I've been in the room where the partners, like I could see like he or she is disappointed. And so there's all this other pressure that comes in, and then it goes on like, oh, wait, Dr. Baker, I know we said we're going to start solids, but so-and-so told me not to. And there's nothing that people have so many opinions on, unsolicited opinions, and frankly, often uninformed opinions as parenting. Like take any topic, like you want to buy a new car, right? If you don't ask your friend, he won't give you an opinion on the car. Right. And when he does, he's like, I don't know, get a red one, right? But when it comes to parenting, you don't ask anybody for anything, and they all give you like a lecture on every aspect. Like, no, don't let Jimmy, he's 6 months old, don't let him stand on his legs. It's going to cause a hip issue. No, where'd you come up with that? No, don't start solids. Don't give eggs at this. It's crazy how much people care about not their kid. Like half the time I'm like, dude, where was all that energy for your kids?
I know.
like when it's third party unsolicited. And so you're right. It's almost the mom's almost a victim of these like, of this whole like overdone, over opinionated kind of trajectory that comes on them. And so I think the breastfeeding is a good example, but I would just warn or give heads up that you should, as a mom or mom to be, or a mom of 3 or wherever you are in your journey, your instincts should be your trump card, like how you feel about what's going on, because everybody giving advice, even me as a pediatrician, doesn't have 2 things that you have that are the 2 most important things. None of us love your kid as much as you do, and none of us know your kid as much as you do. And so those 2 things, that's like, what do they call it, Mo? Like a mic drop. Those are mic drops, right? Like beyond that, like, okay, I went to Harvard, Yale, I got 30 degrees. Cool. That takes a backseat to, I know my kid better than you, and I love my kid more than you. Now we should have an inclusive conversation. Yeah. I bring some expertise, you bring some expertise, but nothing should override those 2 things that are exclusively beholden to the mother, right? Yeah. Can I ask you like some more like, I don't want to say rapid fire, but like some questions about hot topics and stuff and see what your feedback is?
Yes, you can. But I just want to say that I'm so glad to hear you say everything you just said right now, because I say the same things to my clients. I was like, your doctor knows all babies, but does not know your baby as well as you do. Right, and you're going, the way I start my presentation for newborn care is expect to hear conflicting opinions. Yep. And on the tail of that, but you're going to learn to trust your instincts. It's exactly what you said, because a lot of the opinions that are out there are just like sort of blanket recommendations. They're not specific to your situation or your child. So they can feel very hollow, yet parents are floundering. They're like, tell me what to do. I don't understand how to make this work. And, it's part of it is our abysmal parental leave policies that we have in the United States, because people don't get quite enough time to get to know their babies. We're the only industrialized nation that sends women back to work in such a short time frame. And there are repercussions to that. And I think everybody tries to cram in as much knowledge as possible instead of letting it flow in a more organic way because they feel rushed.
Yeah, 100%.
All right. So what's your rapid fire questions?
I have a couple of questions that I know folks would be curious about, given your background and expertise. So let me ask them and then you just hit us up. Okay. So 1, partners. What's the biggest mistake partners make during the pregnancy, delivery, or postpartum period? Well-intentioned, but the biggest misconceptions and then mistakes they make that you think you would like to see undone. Oh, yeah. I see that all the time. Well-meaning partners who are just not quite getting what a significant change has occurred for their partner. The intensity of giving birth,
the physiological changes that occur, how she may be experiencing things that you're not seeing, like vaginal bleeding and urinary incontinence and hemorrhoids and all sorts of problems that stitches on her perineum, all sorts of discomforts that you may not be privy to, or she may not feel comfortable sharing with you. So you're both acting like they're not, that they don't exist. And as a result, partners I often see partners kind of returning to a baseline normal too quickly. It's like they look at their partner and they're like, she's capable of making her own lunch. Why would I even think to bring her lunch or breakfast? She loved eating when she was pregnant. Why would I have to remind her to eat afterwards? I see this all the time. So I do tell my clients to try to be very attentive to her needs, treat her like a patient after you both come home from the hospital, because she is in recovery mode and the body does need to heal. And the uterus takes a couple of weeks to just go back to normal. So there's a lot going on physically. And then there's emotionally with the hormonal changes. So that's a whole other thing that he needs to pay attention to. And then I would add to that is really hold back on visitors. Most new mother, this is what I say to the dads. I'm like, do you remember the last time you had food poisoning or a stomach virus? Did you feel like having a Super Bowl party like right afterwards or during that illness? Did you want to have all your friends come over and sit around and watch TV and expect you to make them chili? Then they're all like, oh God, no. No, I would never have wanted that. Right. I was like, well, try to hold on to that feeling, because that's how she feels when she's hobbling around in an adult diaper, right, and her boobs are leaking milk, right, and your parents come over and ask, hey, what's for breakfast? Yeah.
Right.
So
that's a good,
so that's a big thing. Like trying to get partners to understand what they can't see, what might not be right in front of them.
That's very valuable. Next question. Doulas. Who should engage a doula's help? When should they do it? And what's the advantage of having a doula kind of escort you on this journey? Okay.
So there's two styles of doula. There's the birth doula, and then there's the postpartum doula. Some women do both, as doulas. They're full spectrum, but that's beside the point. In terms of the experience of a person who's pregnant and looking for support, I mean, it's a very personal decision, but I can't really see many downsides to it. There are more birth doulas out there than there are postpartum doulas. It's a very, very different skill set. And the birth doula, you have to feel comfortable with her just in terms of your personality and your trust level. And she needs to be experienced enough to know what her role is and not to overstep that in a way that your provider might feel is inappropriate. That's the main pushback I get from OBs that I speak to who are like, I don't really like when my clients work with doulas. Why? And then I know this other OB practice in New York that insists that their clients work with birth doulas, but from their list. So everybody's been vetted and is very experienced. But the experience for the expectant parents is just having that other level of support. The person you can ask questions to that can give you the time that your provider just cannot give you. You cannot sit in your OB's office and start asking questions about this or that pain or what supplements you should take or whether or not you should continue doing Pilates. Like, they don't have the time to do that. But a birth doula can help you through all of that. And then, of course, they're there at the birth. Your partner is really your emotional support during birth, and your provider's your medical support. But sometimes you need that person in between who understands the medical, who knows about birth, who can support you physically, emotionally, or can just hang back and be there as like your safety net if you need it. So that's why I don't really see a downside in having a birth doula. I feel like the more support you have, the more likely you are to have a good birth experience instead of a traumatic birth experience, which many women unfortunately do have.
How about the postpartum doula?
So there's always been a tradition of having help afterward. More like in the 50s and 60s was this concept of the baby nurse, which we still have today. But the baby nurse comes in and she lives with you. She's there all the time. You have to feed her. You have to offer her a bedroom and a bathroom. And some people don't love that intrusion in their life. And in the New York area, some people don't physically have the room for that extra person in their world. But that is one option. A night nurse is someone who just comes at night. And by the way, these are not RNs. We're using the word nurse in a kind of colloquial way. So they're not nurses. You don't need a nurse to help you. But the baby nurse is there 24/7. The night nurse is there just at night to help you with the baby. And then the postpartum doula. Postpartum doulas have a very different philosophy. They're not there to do things for you. They're there to support you, to help you, to teach you, so that when they walk away, you feel more confident about handling your baby and everything that goes with that, whether it's swaddling or burping or feeding them or giving bottles, like learning how to do all these things. It's nice to have somebody come in and teach you and to guide you. And again, someone to call when you can't bother your pediatrician with every little thing. And it's not a great idea to be Googling everything for obvious reasons. So having the postpartum doula is also your safety net to just, help you through it, to reassure you. And in my case, when I work as a postpartum doula, I'm really trying to safeguard the mother's mental health and to make sure she doesn't go down the slippery slope into postpartum anxiety or depression.
What's one of the best ways? A lot of moms, two common questions are, I know there's a C-section epidemic. I want to make sure I don't get a C-section if I don't need one. And then the second part is, I don't like having pain. I'd like to manage the pain, but I also don't want to be doped up and have any unnecessary meds pass through to the baby. So can you talk about how you can mitigate the chance of an unnecessary C-section and different modalities for pain management?
Okay, well, I get asked those questions a lot when I'm teaching. So the C-section one, the first thing I say to people is, we may have a fairly high C-section rate in the United States currently, but it's going down every year. That's because hospitals and OB practices have an imperative to lower their C-section rate, not raise it. So you'd be surprised how many OBs will say no to a scheduled C-section for non-medical reasons, or will induce you instead of jumping straight to a C-section. There have to be good medical reasons for having a C-section. And that also goes for the unplanned C-section. So they will really try to help you work through your labor by every means that they can, giving you Pitocin, helping you with pain medication with an epidural, doing all sorts of things to kind of regulate your labor, but make sure it's progressing so that you end up with a vaginal delivery and not a surgical delivery. That is not their goal, is to have more C-sections. So that alone should be reassuring. And then as the patient or the pregnant couple, you might want to check out the C-section rate of the hospital you're delivering at and ask your doctor when you're shopping for an OB, what is your C-section rate? You can tell a lot from just that. So, that's one way to safeguard you. But if it's too late, like you're maybe, in your third trimester and you can't switch practices, then it has been shown, and ACOG will attest to that, the American College of Obstetricians and Gynecologists, they do say that the evidence bears that having a birth doula at your birth can lower your risk of a C-section. So at the very least, that's something people can lean on.
Yeah. And pain management?
Well, when I teach about pain management, I always tell people that labor is not like any other pain you've ever experienced. I make people give examples of like horrible things that they endured, a kidney stone or migraine headache or a broken bone. And I try to help them understand that that is pain that is meant to alert your body and your mind that something is wrong. Labor is not that. Labor is not something is wrong with you. It's a physiological, normal process. And if you can just kind of embrace it as like, I'm not in trouble here. This is not a crisis. I don't need to panic. I just have to get through it as my body expels a baby. Of course, that's not going to be comfortable. The expectation is that it's not comfortable, but when you put it in the framework of normalcy rather than like a broken bone pain, your body's telling you something different. It's telling you to pay attention. Something significant is happening inside of you. So I try to steer people into thinking about it a different way. And I use menstruation as an example. You know, cramps are very uncomfortable, and we find ways to cope. Heating pads, getting into water, etc. Labor is very similar. Finding better positions, getting into water if you can. All of those things help diminish your perception of pain. But really, a lot of it's psychological. Just if you can go into it and have your partner support you and a doula, perhaps, to help you understand the normalcy of what you're experiencing, there's less fear. And when there's less fear, there's less anxiety associated with it that causes more pain. So when you diminish the fear, you diminish the perception of pain. Does that make sense?
Makes a lot of sense. Yeah. I appreciate that. So before we wrap up, what are some kind of, based on your extensive experience through the maternal journey, some topics, remarks, comments, offerings you have just at a high level, low level that I didn't ask you about?
Offerings? I mean, in terms of my work, or just like advice and tips?
Either or both.
Oh, all right. I can come up with something. I really think that expectant parents spend a great deal of time focusing on the accessories, the gadgets, the things that they want to buy and decorate and think about in terms of their baby as this concept. And not enough attention is paid to the experience, what is going to change for them, and the relationship when they're on the other side. So having great support as you move through that time period is really imperative. And you can come up with your own support system, or you can lean on someone who's experienced, like maybe a perinatal mental health therapist or a doula or someone who's like knowledgeable about that time period who can say, you know, I think you might need to put this, this, and this in place. So some people can come up with that on their own. Some people need a little bit more guidance. But I do find like when people come to me, a lot of times they already have a history of anxiety and or depression, and they're worried about what it's going to feel like once they've had a baby. They're worried about a mood disorder.
Sure.
So that kind of client is already thinking ahead. I've had people come to me and say, I'm not going to be breastfeeding. I can already tell that it's going to cause me way too much anxiety. So I've decided not to do that. Will you support me with that? And of course, my answer is yes. You know, things like that, like where people are really thinking ahead. They're trying to imagine what their experience is going to be like on the other side, possibly based on prior experience, and then they can be better prepared.
Okay. My last question.
Okay.
So you obviously are with people like at a very pivotal time in their lives and the life of their offspring and so on. What's the part of, so there's a lot of beautiful in that, right? Like, you know, you get to share like these unique moments, lifetime moments, but what is the part of what you do that you don't enjoy?
That I don't enjoy. I thought you were going to say what I want to tell you what I love first.
I know. That's why I didn't ask.
I love getting the text in the morning, like, oh my God, she slept through the night. I love getting that text. That makes me really happy.
That's the mom or the baby?
Both. Yeah, that would be both.
Yeah.
Oh, wow. What do I not enjoy? I mean, I really love everything about it. And even the challenges, I feel like, sometimes I'm saving marriages. I really do a lot of counseling
Sure.
in my work. And I certainly don't like to see when there's problems in the relationship. But it feels very satisfying to be able to help people through that. And if, some of it's out of my reach, I have lots of referrals that I have at my fingertips that I can put in front of them so that they can get a more concentrated style of help. But I guess I don't like when people just don't engage with me. Like I've had occasionally couples who purchase a package with me and then they're like, they never call me. I reach out to them a bunch of times and then they just don't engage. So occasionally I've even given money back being like, let's just wipe our hands of this.
Interesting.
This relationship is not working, but I typically don't do that. And that's like in my agreement. But sometimes I just feel badly. I'm like, look, I don't know why you purchased time with me and you're not using any of it. So let's part ways. I trust that they're having a good, easy time of it. Otherwise they would have called me. They would have needed me. So that's sort of good, but
Okay.
That's the expectation, is that somebody will engage with me a lot.
Yeah.
I do in person, I do Zoom, I do phone, and I do text. I'm very, very accessible. So,
Great. Well, thanks for sharing all that. I think, you do like super unique and super significant work.
Thank you.
I think a lot of people are going to benefit from listening to this conversation.
Oh, thanks.
And
I hope
look forward to a follow-up.
And also all of her videos that are posted on her app.
Yeah.
Which are very helpful.
Yeah, we have Jayne with some videos on the Baker Health app that are super informative. So
and more coming soon.
awesome. Yeah.
That's right.
Yeah. She's the best in the biz. So
Thank you.
Thanks for your time, Jayne.
Thanks very much.